This is Rural Health Leadership Radio.
Hi, everybody. I am your host, Dr. Bill Oxier, and welcome to this special edition of Rural Health Leadership Radio. I'm very excited to introduce today's guest. Today's guest is Dr. Erik McLaughlin, the Chief Medical Officer at AB Healthcare. Welcome to Rural Health Leadership Radio, Erik.
Hello, sir. Thank you very much for having me, and I'm honored to participate very much. Thank you.
Yeah, that's great. So tell us about yourself. Who is Dr. Erik McLaughlin? What's your story?
That's a good one. I was born in San Diego and grew up in Tucson, kind of in a more rural part of the state, and always really had an interest and a passion for medicine. My dad was actually an epidemiologist growing up, so I really enjoyed hearing stories from him about that kind of outbreaks and tracking diseases and things like that. And it was a bit of a surprise me deciding to go to medical school. I had kind of a varied career, and I started out kind of life as an athlete and a firefighter. Okay. And then I realized that there wasn't a lot of retirement plans for old athletes, and carrying those packed up and down stairs as a firefighter was pretty heavy. Yes. So I started pestering a lot of the docs as I was dropping off patients in the emergency departments, and they said, "Dude, why don't you go to medical school, Erik?" I thought, wow, okay. And I knew that I had a big passion and focus in rural medicine from where I grew up. And to me, I wanted to be that one doctor that could handle all these problems for my community. So I went to medical school, undergrad in Tucson in U of A, and medical school in England, a little north of London and Cambridge. Came back and did a family medicine residency in Chicago, MPH at Tulane University in New Orleans, emergency medicine training in Australia, Queensland, and a fellowship in rural and remote medicine in Queensland, Australia as well.
Wow. You've got a very interesting life journey. That's for sure.
Yeah. Yes, sir. Yeah.
Thank you for sharing that with us. So, you could have gone a lot of different directions there, firefighter, athlete, but you decided to become a physician. What made the difference? Why did you decide to do that?
Going back to when I was an EMT and I was dropping patients off, and I would get frustrated. I didn't understand, well, if they have heart failure, why do their feet puff up? Okay. And I was challenged by those complexities, and I really understood. I wanted to understand better biology and the chemistry and the care of patients. And it always seemed like such a lofty goal for someone like me with where I came from and what I was kind of surrounded by growing up. And the ability to care for people in rural areas was specifically why I went to medicine. Okay. I really wanted to help people overcome those barriers, bring the care to them, and kind of be that one-stop resource for them. And it's been a great journey. I wouldn't think of my life without medicine. It'd be incredible to think of it without it.
So you've mentioned several times you were attracted to rural, and when you're a physician, you pretty much work wherever you want, right? Yeah. So what is it about rural that you find so attractive?
We know from literature that rural kids grow up and they go back and work in rural areas. They're the people that I feel more associated with. The relationships are truer. They're stronger. The ability to bump into somebody that you take care of out at having a dinner is cool. I dig that. And I like being able to kind of be involved in that holistic care of a family and a community. I like taking care of a sick kid with a strep throat, and then seeing grandma when she's weak and dizzy, and then dealing with dad for a broken arm when he crashed on his ATV. I like that full scope of medical practice. I like the ability to be involved in a community, and I like the people. They're just the kind of people I hang out with and have a beer with, Okay.
All right. I get it. Thank you. Thanks for sharing that with us. So, Erik, as you know, the name of this program is Rural Health Leadership Radio, and I emphasize the word leadership. What's your definition of leadership?
Leadership is doing it by example.
Okay.
Period. That's the most basic definition I can give, is that you need to be the one that understands your job and the job of people underneath you. You need to never ask somebody to do something you're not willing to do. You need to be the first one in and the last one out. And you need to role model for everybody that works with you, for you, under you, above you. And I think, to me, that's what's critical in defining leadership, is that you're leading by example. You are the one at the front, and your team is following beside you and behind you, but you're at the front. And I think that's important and lost a lot today.
Okay. Thank you for sharing that definition. Appreciate that. So you're the Chief Medical Officer at AB Healthcare. Can you give us an overview of AB Healthcare and what you do, the community that you serve?
Sure. So AB Healthcare is actually kind of the parent company for 3 entities. We have AB Staffing,
Okay.
which is about 18 or 19-year-old business working in several countries, and I believe 41 states at the moment. We provide contingent medical labor, everything from medical assistants all the way up through phlebotomy, allied health, physical therapy, nurses, medical assistants, nurse practitioners, and physicians, all the way up to subspecialty level.
Okay.
So we provide labor to chiefly federal, but some private and tribal entities. Veterans Administration and IHS are some of our bigger clients.
Okay. All right.
Then you have AB Med, which is I'm going to call it practice management and consulting side of things.
Okay.
This was started in response to our partners and clients that we work with saying, wow, we really like the people you're sending us, and we like the conversations we're having with you. Can you help us with this problem? We need more leadership in our emergency department, or we need a public health program into our community, or we need X problem solved. And our staffing vehicle wasn't really set up to be able to accomplish that very well. It didn't have that expertise. So
Right.
AB Med was created to develop some of these more project management and design services.
Okay.
And then lastly, we have Adaptive Workforce Solutions, which is a vendor management system.
Oh, very interesting. Okay.
Yes.
Thank you for that clarification. Now, as we all know, the COVID-19 pandemic has turned everybody's world upside down, right? So
Yeah.
what impact has it had on you and your organization?
You know, we've been very blessed in the fact that we have seen a tremendous uptick in our business.
Really?
We have had remarkable needs and outreaches to us for support. This has been in the early phases in certain geographical areas, New York City, Louisiana, Southern California, Washington, when there were these hot spots erupting early in the phase. We were very proud of the ability to put down hundreds of critical care and emergency medicine doctors, hundreds of nurses in support of FEMA and HHS to help staff these pop-up facilities that were there to deal with these surge of patients.
Okay.
Since then, we've been doing a lot of what I call healthcare system strengthening, where we're sending in some COVID experienced physicians and nurses to help in the areas as these spot fires are cropping up,
Okay.
to get them up to speed on some best practices. We're a lot of the groups we work with are some underserved or underprivileged areas. So we're very proud of the fact that we're donating hundreds of thousands of dollars of PPE equipment
Okay.
to some Native American tribes. And they're good people that need some good equipment, and we're happy to help with that. And then, lastly and most recently, my background in public health has seen a tremendous need for contact tracing, setting up testing programs, devising case management, and helping squash these spot fires as they erupt around the country before they be, fulminant outbreaks. So the contact tracing and testing and employee health screening has been a huge part of my last probably 6 to 8 weeks.
Wow. Yeah. Thank God we have people and organizations like you to help out with that sort of thing.
Thank you.
You've talked about serving the underserved and everything. So
Yeah.
what does rural play in your organization? Because it sounds like you do more than just rural, but why is rural important to you?
Our company is owned by one family. And all the C-suite and all of us in leadership roles were rural kids, all from Southern Arizona. Our CEO, he grew up on a dairy farm in between Tucson and Phoenix. I grew up in not in Tucson, but in a suburb of Tucson called Marana. That's a little more rural. We're a farming community, as everyone teases me that we have more cows than people where I grew up. And it's just where we kind of, like I said, align our values, align our mission, and it's a big passion project. I would personally enjoy the challenges in rural medicine a lot more than having all the bells and whistles of a big city in front of me with its own problems. I like the challenges of rural, and this is very much where our minds and our heads are at when we deliver our care.
Okay, that makes sense. So if a rural health leader, whether they're running a rural hospital or a rural clinic or whatever, let's say they decide they need an outside provider for staffing, that seems like that's a big piece of your business. What are some of the top things that they need to consider when they're making that decision of who they should collaborate with, partner with?
That's a great question, because as I mentioned before, rural medicine requires a good fit.
Mm-hmm.
We're not trying to bring big city medicine to the rural areas or the frontier areas. We're trying to develop good medicine in those regions that's specific to that community and that patient population. That's a critical ethos I have. Some of the questions that you need to look at when you're selecting some labor staff, docs, nurses, are they going to be a good fit for the community? What kind of longevity are they looking to have? Are these the people that you want to see at church on Sunday? Are these the people that you would feel comfortable playing with their kids in the backyard, because they're going to be woven into your community?
Right.
Are they competent? Rural medicine, I think, is the best and the hardest type of medicine, because, man, you got to wear a lot of hats, and you are going to be the worst pediatrician, the worst surgeon, the worst obstetrician, because you're doing it all.
Right.
And, you often feel like an 8-armed octopus trying to juggle all these hats and things and double duties. So you really look for somebody that has a passion for lifelong learning. You look for somebody that really has a passion for full service scope of practice of medicine. And you want somebody who's cool. You want them to fit in nice to your community. You don't want to bring in somebody with different values or different ideas, because they're going to just be a fish out of water, and then the community suffers in their healthcare. Those are my things to look at.
Great. Thank you. So in your experience, you've worked with a lot of different rural health leaders, right? What are some of the best practices that you've seen some of the top rural health leaders, people you respect? What are some of the best practices you've seen them use that are worth sharing with our listening audience today?
The common thread of everybody I've enjoyed working with and taken a lot from as a mentor-mentee relationship.
Yes.
Is going back to that definition of leadership. They lead from the front. They're real doctors. They're real community members. They have passion and care for their community. And you can smell that when they don't a mile away. If they're there because they're getting a better paycheck and some remote incentive pay, man, you're gonna see that in a few months. And nobody likes that. That's the wrong reason to be there. It's these people that really have a passion for rural. They understand the people, the community, the needs, and they're willing to roll up their sleeves and get in there and do it too.
Excellent. So can you share with us a story about one of your clients? You don't have to name them unless you want to. A client where their partnership with you really made a big impact.
Yeah. We work with a group in, I'm going to just say Middle America.
Okay.
And this hospital was closed. They had lost their certifications. They lost their ability to bill. They were literally closed. And, in a matter of about 60 days, we were able to put boots on the ground, docs, nurses, inventory, everything, get them up, running, open, walk them through their accreditation processes, get them back on billing schedules. And now we're doing a lot of fine tuning, but man, they're back up and running again.
Wow.
And to me, as we're facing a lot of these hospital closures in rural areas,
yes,
the idea of having to drive 2 hours for medical care to me is absolutely unacceptable. That's, if my little boy or my little girl or my family members having an asthma attack, I want them to be seen soon and close in my own community by a face I trust. And those windows of travel are blowing windows of time for life-saving interventions, the golden hour for trauma, the thrombolytic for the stroke. that's a big one is to me, being able to have healthcare in the community. So you don't have to go away to get emergency and medical services.
Well, I love your passion as you explain and tell these stories. So thank you.
Thank you. Yeah, I love
Eric,
it, obviously.
Yeah. Eric, what scares you the most about the future of rural health?
The formation of these cells of, I'm going to call them ivory tower type medicine, and the fact that hospitals are, they're being re-centralized. Back in the 1800s, we went through the Florence Nightingale era, where we collected all the patients together and we treated them there. We saw there was a problem there, so we kind of decentralized our healthcare back out into the communities again. And now we're seeing, through reimbursement problems and fiscal issues, closures of hospitals and rural areas. Like I said, man, if you got to go a few hours, that's horrible. So I think that's my biggest fear, is getting money for decent medical services in rural areas so that we can keep providing this life-saving care. That's my biggest fear, sir.
Yeah, I get that. So let me flip that question around for you now. What excites you the most about the future of rural health?
We are probably the best docs and nurses and leaders in the planet, I believe. We can do the most with nothing, and we do it with a lot of passion.
Excellent.
Meeting a lot of great leaders in the NRHA has been awesome, because I see so many kindreds of spirits and mind, and everybody's got a lot of passion, and that's going to be the savior, I believe.
Yes, so the people that you meet are quite fascinating in the work that they're doing and the passion they bring to it. People like you, Eric.
Yes, sir. Thank you.
The time has flown by while we've been talking here. We've covered a lot of territory in our conversation. If our listeners only take one thing away from our conversation today, what should that be?
Having to go far away from your home for medical care is unacceptable. Let's advocate to get good medical care in your community and make it the care that's culturally competent for your people.
Dr. Erik McLaughlin, Chief Medical Officer at AB Healthcare, thank you so much for sharing your knowledge and expertise with us today.
Thank you for hosting me. I appreciate your time, and thank you. Have a great day, sir.
Absolutely. Now, if you'd like to connect with Dr. McLaughlin or learn more about AB Healthcare, you can look at the notes below this video, and you can find their contact information along with the AB Healthcare's website. And all else fails, reach out to me. I'll be glad to connect you with them. And if you'd like to subscribe to Rural Health Leadership Radio, where we interview a different rural health leader every week and share best practices, hey, you got a smartphone? There's a podcast app on that. Just go to the search function and look for Rural Health Leadership Radio. Or you can also visit our website at rhlradio.com. Now, if you enjoyed today's episode of Rural Health Leadership Radio, maybe something that Eric said that resonated with you or piqued your interest, let us know. Or maybe you know someone who might benefit from listening to this conversation. If that's the case, please share, because we are all here to serve. Until next time, let's keep working to improve rural health, one conversation at a time.